Hello, my name is Tessa Hartsell, and tonight I'm going to be doing my final video for this semester, and my assistant will be Jeffrey Hartsell. So tonight what we're going to be doing is we're going to be going over the whole system and assessing the whole body as an entire system. And first what I'm going to do is I'm going to look at the color of the skin and the upper extremities and feel the texture. So what I want to do is, can you remove your shirt for me? Is look at the skin and the texture of the upper extremities as well as the temperature, and make sure that they are even. You don't feel any coolness or warmness in either of the extremities. You also want to look at the skin condition, look for any lesions or injuries to the skin. You want to assess the skin turgor. This checks the hydration status. You can do that just by pinching up skin there. Alright, so his color and temperature, texture of the skin of the upper extremities is within normal limits. You would also want to do the same thing for the lower extremities. So once again, you just sort of look at the skin, look for any lesions, any discolorations, change in temperature, and you check bilaterally. You also look for any veins, varicose or spider veins that can prove to be like circulation problems, and also looking for any edema, which I'm not seeing any on my patient. Also, when you're assessing the upper extremities, the nails can tell you a lot about the patient. It can tell you about the patient's hygiene and nutritional status. You look at the nail beds to make sure that they're intact. You look for any clubbing. This can show a sign of decreased oxygen. You see it often in smokers. You also check the capillary refills and make sure that the cap refills are within normal limits, and his are. Alright, you can put that down. And next we're going to look at the head and the scalp. While assessing the head and scalp, you want to make sure everything is symmetrical. There's no discolorations. You also want to palpate and let your patient know that during this time, if they feel any tenderness, to let you know. You want to look at the scalp. This also tells you about their nutritional status. If the client has hair, you want to look at the hair and see that it's spread evenly over the head. You want to palpate when you're looking at the head. The sinuses, also having the patient let you know if they experience any tenderness during that time. You also want to look at the jaw and test for TMJ. And this is checking the cranial nerve 5, the trigeminal. And what I want you to do is I want you to clench your jaw for me. Alright, I want you to look at me and smile. This is testing cranial nerve 7, the facial. Smile, frown, puff out your cheeks, purse your lips, sort of like you're going to give a kiss. Show your teeth. Alright, and I want you to raise your eyebrows and close your eyes. Alright, perfect. And that's testing, all of that is testing the cranial nerve 7. Next, we're going to move to the visual, the eyes, and what we're going to do is I'm going to just tell you a little bit about the Snellen distant vision test. What this does is normally you would have your patient sit and you would have the Snellen chart off in the distance, and this is checking for distant vision, and you would have the patient read along the numbers until they can't read anymore, and the numbers get smaller as they go down. And then the Rosenbaum test is testing for near vision, and what you would just have is you'd have the client hold the card itself and then read with it up close to them as if they were reading a book, and this tests for near vision. Next, we're going to do the confrontation, and what I'm going to have you do is I'm going to have you cover one eye, and this is just a blank note card, And I'm going to cover the same eye, and I'm going to bring this pen light, and we'll get even with you, I'm going to bring this pen light into your gaze, and you let me know when you can see this pen light coming down.
I see it.
Okay, we're going to go from the bottom, looking straight ahead.
I see it.
Okay, and then we'll do it with the other eye,
I see it.
and then from the bottom.
I see it.
Okay, perfect. And that's Tessa in confrontation. All right, moving on, we're going to look at the cardinal 6 fields of gaze, and this is also testing the cranial nerves 4 and 5 when you're looking at the cardinal field of gaze. So what I'm going to do is I'm going to have you look straight at me, and I want you to have your eyes and follow this pen light without moving your head, just moving your eyes. Then we're going to come back to the center. And once again, this is testing the cranial nerves 4 and 6. Perfect. Alright, next we're going to do the cover and uncover test. And what I'm going to have you do is just sort of stare off sort of into the distance. And what I'm doing is I'm going to just sort of look at your pupil. I'm going to cover, and I'm going to make sure your pupil, assessing your pupil at this time. So just look off in the distance. And what I'm looking for is just to make sure that vision stays straight ahead and that there's no change. Alright, perfect. Alright, next, as far as when you're inspecting the eyes, you also want to look for symmetry and make sure that there's no lid drooping. At this time, you want to look at the cornea and the lids, look for any redness or any exudate. When you're looking at the eye, you also want to palpate any tenderness. All right, using the ophthalmoscope, you start off in the distance here, and during this time I'm looking for the red reflex, looking back at the macula, looking for any hemorrhages or anything within the eye. So just sort of look straight ahead. Alright, perfect. Moving down to the nose, you also look for the shape of the nose. Make sure there's no deviation of the nose. Looking at size, shape, color. Also, you can test the olfactory nerve, which is cranial nerve 7. So what I'm going to have you do is close your eyes. I'm going to put something under your nose, and you just tell me what it is that you smell.
An orange.
Okay, perfect. Also, when you're inspecting the nose, you also want to look for patency of the nostrils. Alright, perfect. Moving to the mouth, same thing, you want to look at the mouth, if you can open your eyes. And when you're looking at the mouth, you want to look at the inside of the gums, the teeth, the lips. Look for the moisture. This can also tell you a little bit about hydration status. So what I want you to do is I'm looking at cranial nerve number 7. I want you to open your mouth and stick out your tongue. Alright, perfect. And show me your teeth. Alright, perfect. Also, in this area is cranial nerve 10, the vagus, and you would test this by having the patient swallow, speak, and also by testing the gag reflex, which is very important, especially if they've coming out of surgery and have some type of sedation. Can you say ah? Ah. 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 Okay, perfect. And that's looking at the uvula there. Next, we're going to move to the ears, and I'm going to start by performing a whisper test. And what I'm going to do is go behind you, and I'm going to whisper something in each ear, and you let me know what it is you hear.
Okay. Christmas is coming soon. It's cold outside.
Perfect. And this is just, once again, the whisper test that I'm testing. Next, we're going to do the Weber test. And this is just the Weber and Rhine test. Feel the vibration. Alright, and next is the Rhine test, and what I'm going to do is I'm going to hold it to the back of your ear. You let me know when you no longer feel the vibration, and then I'm going to move it to the side of your ear here, and then you let me know when you no longer hear. Okay?
Okay.
Alright, perfect. Also, when you're inside the ear, you would also want to use your otoscope to look into the ear. Also, any tenderness there?
No.
And when you're looking with your otoscope, you would look inside the ear for the at the tympanic membrane, which should be a grayish color. You look for any drainage. You also would look at the cone of light reflex and deeper down into the ear canal for any obstructions or anything that may be present. Unfortunately, I don't have my otoscope with me, or we would be doing that at this time, but those are just a few of the things you would look at if you had the otoscope. Alright, so what I'm going to do is I'm going to do a quick survey of the room, and then we are going to move to the cardiovascular system. You can just stay sitting there. Sort of move over. Patient, oops. And what I have here is just some of the things that I would need for my assessment here. Here's the other paper that has the orange in it. My patient will be moving to the couch here shortly. And then I'm back here. This is what my actual video camera is sitting on. And then we're back at the TV. Alright, so back to my patient, and we are moving to the cardiovascular system, and once again, you are just looking at the chest, looking for any heaves or thrusts, anything abnormal. You want to palpate the chest for any murmurs. You also, at this time, would palpate your temporal arteries, your brachial and your radial arteries, and you want to do this bilaterally. As well as the popliteal, the dorsal pedis, and the posterior tibia. Also, I need to run and get my stethoscope because I forgot to put that there. I'll be right back, okay?
Okay.
Yeah, I was forgetting something. Alright, so also in the cardiovascular system, you would also want to auscultate. Just breathe right there. And you listen to the aortic valve, pulmonic, Erb's point, mitral, tricuspid. Okay, at this point, you also can be assessing the respiratory system. Of course, counting respirations, and you want to not let the patient know you're counting respirations because this can affect their breathing pattern. But you're looking at the chest wall for equal rise and fall of the chest, looking at their respiratory pattern. Make sure it's a regular, normal breathing pattern, and you want to assess both the front and the back. You're looking for any thoracic expansion. And so once again, you want to listen to both the anterior and posterior lung fields. Take some deep breaths. And same thing when you're looking, listening to the posterior, you want to do it bilaterally. And once again, you would go down and listen to all the lung fields down and around each lung there. You also want to percuss the lung fields as well. And you would do this, once again, along all the lung fields, both anteriorly and posteriorly. And of course, while you're doing that, you would want to let the patient know, to let you know if they feel any tenderness or pain. And also when you're doing that and you're palpating these different areas, you're looking for any bulges or anything that seems abnormal. And can you lean up just a little bit? And can you just say 99?
99.
One more time.
99.
Okay. And then back. And do the same thing.
99. 99.
Okay, perfect. So now moving to the abdomen, once again, you're looking at color, symmetry, making sure you don't see any bulges, hernias. You're looking at the belly button, the umbilicus, to make sure that it looks normal. You're looking for stretch marks, any abnormalities with the abdomen at this time. And you always want to listen to vowel sounds first before you percuss or palpate the abdomen, because this can affect the vowel sounds, and you want to make sure you listen in each quadrant for the vowel sounds. Alright, this time I just need you to, let's see, I need you to lay down just so I can percuss the abdomen and everything, but then we're going to come right back. I'm going to just make sure you're within, just move this down, and then we'll move it back up, because then we're going to go back up for a moment. Put this little table right here. So at this time, I'm just going to percuss the abdomen here. You hear a duller sound as you go over the liver. And also at this time you can palpate the liver. And measure as well, and upon measurement it should be right at 10 centimeters. We're looking right about 10 centimeters. Also, because the spleen, during this time, of course, letting the patient know if they experience any tenderness to let you know. And then you can palpate the kidneys, which are very hard to palpate. Okay. All right. I need you to get back up for me here. Sit back in the chair. I will move the video camera back up once again. Back on my subject. And now we're going to take a look and inspect your hands and your joints and everything. So at this time what I'm doing is I'm just inspecting the hand and palpating the wrist and the hands, the fingers. And you want to do this bilaterally. Let the patient know if they experience any pain to let you know. Alright, what I want you to do is hold your hands apart, and I'm going to try to push your fingers in and you try to resist. Alright. Alright, and bring them in and squeeze. Okay, perfect. I want you to squeeze my fingers here. Alright, perfect. Same thing with the elbow. I want you to bend. And then straighten the elbow. And shoulders, lift the shoulders. Okay. Alright, can you stand up and sort of bend at your hips? Bend forward. Okay, perfect. Alright, you can have a seat again. Again, bending the knees, the ankles, bending them. And then the toes also. Palpating and inspecting each joint. Alright, so moving to your neck, we're going to do forward flexion, which you just sort of touch your chin to your chest. Alright, perfect. And then back extension, where you just sort of tilt your head back. Alright, and then side to side lateral, sort of try to put your ear to your chin without lifting your shoulders. Okay. Alright, and then the other side. Okay, perfect. Alright, and I want you to sort of try to lay your head on your shoulder again against me. Alright, same thing here. Alright, push forwards, push backwards. Turn your head to the side and to this side. Perfect. Okay, same thing with shoulders. I want you to shrug your shoulders and try to sort of pull your arms back. Alright, perfect. Alright, I want you to lift your shoulders against, alright, lift your arms. Lift your arms against my, alright, pull your shoulders up, pull them down. Alright, perfect. Same thing with elbows. We're going to test the strength. So I want you to sort of try to pull against my hand and then push against it. Perfect. Going back to your fingers, I want you to touch your thumb to each of your fingers and then touch your thumb to the base of your pinky. All right, good. All right, so now I'm going to get you to go back to the couch again, and we're going to look at your hips and do a little bit more with the feet and ankle. Once again, I'm just going to drop this down a little bit. Okay. All right. So normally we would have you laying flat. This couch is a little short. What I want you to do is raise one leg up. All right, perfect. And you can bring it back down. And then I want you to bring your knee to your chest. Okay, perfect. All right. Now I want you to raise your leg up against pressure. Okay, raise your leg up. Try to bring it down. Okay. Same thing with your knee. Pull up, down. All right, you can straighten there. All right, I want you to push your foot against me as in plantar flexion, and then pull against me. All right, great. And that's testing the ankle strength and movement. What I want you to do is turn your leg and then raise it up, internal, and then just sort of rub it like against your leg and then back down. Perfect. And then turn it outwards. Okay. Perfect. Now I want you to stand up and we're going to look at your spine. You can just sort of stand right in front of me. And I want you to sort of bend down to touch your toes. And this is where you would look for scoliosis, okay? And then same thing, we're going to bend forwards again and then bend backwards. And then I want you to turn side to side, keeping your pelvis still. Just turn at the waist. Okay, perfect. And you can just sit down. And we're going to do rapid hand movement where I just want you to do this right here. This is perfect. And then we're going to do arms out to the side. This is finger to nose. I just want you to bring your finger in and touch your nose. And then that's perfect. Okay, perfect. And now what I'm going to do is I'm going to have you close your eyes, and I am going to write a number in your hand, and I want you to tell me what that number is.
3.
And this is graphothesis, okay? One more time. A letter.
H.
Okay, perfect. All right. And with your eyes still closed, I'm going to put something in your hand, 2 different objects, and I want you to tell me what this is.
Paperclip.
Okay, and this one?
My chapstick.
Okay, perfect. All right, next we're going to do light pain, and what I'm going to do is we're going to light touch the pain. And using this paper clip, I'm going to, we're going to test if you feel pain versus light touch and make sure you feel both of them. So I want to touch you in an area and you tell me if you feel more like a pain, and this is what that will feel like, or if you feel like a dull light touch, and that's what that will feel like, okay?
Pain.
Where?
On my shoulder.
Okay.
Light touch on my shoulder.
Okay. Sorry.
Pain.
All right.
Light touch on my shoulder.
All right. Next, I am going to go over a couple bony prominences and see if you can feel the vibration. And you just let me know if you can feel a vibration and sort of when it ends, okay? If you just close your eyes.
Okay. Okay.
let's see. Next, we're going to just test some of your reflexes, which once again, I do not have the reflex hammer. But what we would do is we would test your brachial reflex, also your bicep and your tricep, your patellar, and then we would have you get sort of on your knees on here, and then I would test the back of your ankle reflex here. One thing I forgot when looking at my table here is your cornea reflex. So I want you to just look straight ahead. I'm just touching it with a cotton ball, and just to make sure that you blinked against the light touch. The final thing that we're going to do, just move the table out of the way, is we're going to do a heel-to-toe gait and the Romberg sign. So I'll tell you sort of what I'm expecting you to do with the Romberg. You just sort of stand with your feet apart. You can just sort of stand this way, and I'll videotape you. Stand with your feet apart a little, and then I want you to close your eyes, and I'm looking for any swaying. And then after that, then you'll just do a couple steps doing heel-to-toe gait, okay? This is the Romberg, and we see no swaying, okay? And then you can just do a couple heel-to-toe gait. All right, perfect. And that is the end of my assessment.